So who are the uninsured? One of 6 of you are uninsured. Wanda came to us in our clinic. She was employed but without health insurance. Wanda didn't know that her blood pressure, she hadn't seen a doctor in 12 years. She didn't know that her blood pressure was over 300. Why don't people just go get a job? That's the question that oftentimes people ask, but they do. 75% of people who are uninsured are employed or have somebody in their family who are employed. When people who are uninsured get sick, they go to the emergency room. It's the only alternative for them. It's the only place that's mandated to take them. That's where Wanda would go. She had an emergent situation, being 300 in her blood pressure, but the problem is that emergency rooms are only designed for emergencies. They're not designed to handle chronic care. It also costs emergency departments 8 times as much as a clinic to treat chronic conditions. It's all about access. So whatever you struggle with, depression or diabetes or whatever it may be, it needs to be treated in a way, but you can only go to the place that will take you in. So why should you even give a rip? Well, it's because it's your sister, or it's your next door neighbor, or it's your coworker who is unemployed or uninsured. You should also care because it costs a lot of money, because people will waste away in their health status, and they will end up using medical assistance or some substitute. Shepherd's Clinic we started 20 years ago. We'll get ready to celebrate our 20th anniversary this June. It's a very unique place. If you've ever been there, I'll give you the grand tour if you'd like to come. This is about 200 feet from where you're sitting right now, Seventh Baptist Church. I was pastor of that church, and we owned all the properties across the street. We had all kinds of ministries, and it was really interesting. The woman on the bottom on the right standing, she was a PA at Union's emergency room. She was frustrated by the quantity of uninsured people who were using it for care. That basement there is where we started the clinic. It was a wild, wild idea. We made friends with Union Memorial through Bill Finney, who was a retired chief of staff there. He heard about the concept, came over, fell in love with it. His wife said he's driving her crazy in his retirement anyway. So Bill came and became our first volunteer medical director. Union Memorial, therefore, triages their non-emergency uninsured patients to us, and we send all our surgical cases, our diagnostic procedures, everybody back to them for free as charity care. We've grown like crazy. The section on the right, number 3, that's where we currently exist. This is what we've always done. Physical exams, we do blood draws, we do PT, we do gastroenterology, cardiology, psychiatry, clinical counseling. We'll handle surgeries. We do everything. It's 1 hour's wage donation if a person has it. And now we do this. 2 years ago, we created a wellness center. So you could come in and you could struggle with chronic lower back pain, and it's not just medication that will reduce your pain, but it may be acupuncture. So we offer all of those services under one roof, and it's all done by volunteers. So we have 300 volunteers that provide all our services. There are only 8 people that work there. 2 of us are full-time. All of these volunteers are wonderful people. The patients come in and they're very happy because they don't have access anywhere else. We've doubled our patient population in the last 3 years. Right now we see 6,500 patient visits a year, and in probably 2 years we'll be up at 10,000. For every buck that you would give, it turns immediately into 4. We ask every single day, are people getting well? And we've begun to quantify that. It's very easy to come up with qualitative pictures of, you know, you saved my life, all of those kinds of things. We're beginning to really put it together in terms of cholesterol and blood pressure and other kinds of things that quantify the fact that people are getting well. So the question is, if healthcare reform is to get people insured, what's going to happen to a clinic that only deals with the uninsured? Well, every indication is that there will be uninsured, and many of them, because they still can't afford, even with subsidies. Our wish list, if you're a psychiatrist, raise your hand. If you know a psychiatrist, raise your hand. If you see a psychiatrist, raise your hand. We need psychiatrists to come and volunteer at the clinic. We need lots of things. Go on our website, shepherdsclinic.org. It has no relationship with Shepherd Pratt, spelled differently, sheep and shepherd. It's a no-brainer that we'd love your contributions. Just click the donate now. It's very easy on the website. If you know anybody who is uninsured, please send them our way if they live in Baltimore City. Okay, thanks.